Delta Airlines, as a nurse, I have a bone to pick with you. On a flight recently, I had a medical emergency and I didn't have the right equipment, and you can't tell me that you don't have enough money to have the right equipment on the plane for me to take care of a patient. Hi, I'm Kelly. I'm a stay-at-home mom to 3 perfect little girls, and I have a little story for you about a medical emergency that happened on a plane that I was on. So I'm sitting in my seat, I have my headphones in, and I'm about to fall asleep, and I heard something on the overhead, and I was like, wait, did they just ask for a medical personnel? And so I looked to the back of the plane, and I realized there's literally legs on the floor. I didn't see the whole person's body, but I just saw legs, and I was like, I think they need some help. So went to the back of the plane and I was like, what's the situation? The flight attendants, bless them, they're doing so great. They just said this woman came out of the bathroom, she said she has pain, and then she just kind of collapsed and we brought her to the floor. So she's in the back of the plane by the bathrooms. So first off, bless his soul, I think Steven is his name. He came down and he's an emergency room nurse, and thank God for him because we definitely needed to be a team. So we're assessing the situation. The woman's diaphoretic, she doesn't speak really good English, and she can't really tell us what's going on. Disclaimer, she's okay. But our first assessment is like airway, breathing, circulation. Her airway's fine. She's super pale, like her blood pressure had dropped. Her pulse is kind of thready. It's hard to feel a pulse. And then they bring out the medical equipment that they have on the plane. And they give me literally a Fisher-Price stethoscope, might even be better than this. So we have these on our COVID cards on our unit. They're kind of like the throwaway. They probably cost like 10 cents. And they don't work. Like if you try to listen to somebody in a normal setting where it's not loud and you have one-on-one attention with a patient, it's still hard to hear their lungs with these. So just imagine that, like you're listening to literally a Fisher-Price stethoscope on a plane that's loud. So then they give me a manual blood pressure cuff to get a blood pressure on this woman whose pulse I can't hear when I'm trying to take the manual blood pressure. And mind you, we just had a stint of COVID and a whole bunch of nurses that went through nursing school online, and then a bunch of people who, like me, I rarely have to do a manual blood pressure. Yes, do I feel comfortable with it? Of course, but I rarely have to do it on the job anymore because all these places have manual blood pressures. So I'm also thinking, if a flight attendant had to take care of this patient, they're like, what's their blood pressure? At the very least, it would probably be nice for them to have a manual blood pressure so they don't have to worry about trying to do a manual. They did have a great pulse oximeter, so I was able to see her oxygenation status and her pulse. She was doing great. For this particular woman, I think what happened was she had a lot of pain, and that caused a vasovagal response, and it made her pass out or almost pass out. But she's okay. Like, she just needs some time to come to. She drank some juice, she had some water, she just laid there for a while, and we just kind of sat with her and assessed her, and she was fine. Delta. We need better stethoscopes. We need automatic blood pressure cuffs if you're expecting new nurses that have never used them in a while, flight